Welcome to Floyd Valley Healthcare Joint Cap. At Floyd Valley Healthcare, we're focused on keeping all the care you need convenient, accessible, local, and you moving. In this video, our staff will review your knee procedure, how to prepare, and what you can expect when you head home after being discharged. Making the decision to have a joint replacement is a big one. Our joint camp will review your procedure and help you take advantage of all the post-op care and services available at Floyd Valley that can make your surgery a success. Let's get started.
Here's what you'll need to know before your surgery. Now, no matter how independent you are, you'll need assistance. This means you'll need to plan for help at home. You'll need to consider equipment needed at home, meal prep or assistance, and help at home, such as family members or home health.
If you have any of these items available, they can support your recovery at home, such as a toilet riser, grab bars in the shower, or grab bars near the toilet for transfer on and off, slip-on shoes, looser pants, or a shower chair or bench for bathing.
You will need to use a walker after surgery to assist in pain control and improved movement. We recommend a front-wheeled walker, not a four-wheeled walker with a seat. Four-wheeled walkers do not allow you to walk within the frame of the walker and tend to get away from you too easily. If you have a walker at home or can borrow one, please bring it with you. We will be able to adjust it to the correct height for you. If you do not have access to one, insurance will typically cover one assistive device every 5 years. Floyd Valley Healthcare can assist you in getting a walker through insurance while you are in the hospital if needed. You can prepare your home by moving frequently used items that are on a lower shelf to counter height. You are technically allowed to bend over after surgery, but it will be uncomfortable and is not recommended. Pick up or move any throw rugs, extension cords, or other tripping hazards such as pet toys. Move furniture so that you have pathways that a walker will fit through. If you have stairs that are wide enough to fully set a walker onto, you can be taught to use the walker to go up and down. If you have narrow stairs without a railing or grab bar, please consider installing at least one grab bar or hand railing.
If you have steps to get into your home, you'll want to consider how many there are and if they could arise as an issue later on. Also, keep in mind the location of your bedroom and bathroom. If they're not on the main floor, you'll want to consider another temporary option. Cooking may also be a challenge after your procedure. If you have concerns about meals, please let us know the day you have surgery and we can help you with this. And again, don't forget to discuss help at home. Don't go it alone. Having the proper assistance and following your treatment plan will support a successful recovery.
Let's discuss recommended preoperative exercises. Your team will provide a handout detailing the preoperative exercise recommendations. These exercises create a motor memory in the muscles, which will help you with your recovery after surgery. The first exercise is the straight leg raise. These can be completed on a bed or couch. To start, lie down on your back with your hips square and your legs laid out comfortably. Then bend the knee of your non-injured leg at a 90-degree angle, planting the foot flatly on the bed. Inhale slowly, lifting the straight leg 6 inches off of the bed. Hold that for approximately 3 seconds. Exhale slowly and lower the leg to the bed with control. Relax and repeat 10 times more. The second exercise is the quad set. These can be completed on a bed or couch. First, place a small rolled up hand towel underneath your affected knee. Gently push the back of your knee down toward the bed or couch, squashing the towel. Hold for 3 seconds and relax. Repeat this exercise 10 times within 10 minutes or until your leg is tired. The third exercise is a heel slide where you bend and straighten your knee. To start, lie on your back on a couch or a bed with one leg straight. Your non-injured leg should be bent with your foot flat on the bed. Slowly bend your straight leg by raising your knee up while sliding your foot toward you on the bed. Bend your knee as much as you can. Then slowly slide your foot away from you, lowering your leg back down. The fourth exercise is a seated knee bend. First, sit upright with your thighs supported in a chair. Bend your affected knee as far back as possible. Hold for 10 seconds. Straighten your affected knee as far as possible and hold for 5 to 10 seconds, then relax.
We'll need a complete list of the prescription medications, over-the-counter medications, vitamins, and supplements that you currently take. The pre-op nurse will call to discuss which medications must be stopped and which are cleared to take the day of. Any routine medications needed during your stay will be provided by Floyd Valley Healthcare, as well as any needed for pain, blood clot prevention, or infection prevention.
The night before surgery, we're gonna have you shower up real good using an antibacterial soap. Any antibacterial soap, just as long as it says antibacterial soap. Scrub that extremity up real well. Don't put any lotions, creams, or powders on after you shower up. Nothing to eat or drink after midnight, the night prior to surgery. You can continue to drink clear liquids up until 4 hours prior if you're diabetic and 3 hours if you're non-diabetic. We do recommend that you drink a 12-ounce Gatorade of your choice as your last drink. It just gives your body electrolytes and some good carbs to kind of get you through that surgery. The morning of surgery, we'll have you shower again using that same antibacterial soap. Again, no lotions, creams, or powders after you shower. Make sure that you don't have any toenail polish on. Remove all the jewelry, leave all your valuables at home. Check-in time is going to be 2 hours prior to surgery. You'll check in here at Floyd Valley using the west entrance of the hospital. When you check in, you're going to need your photo ID, your insurance information, your overnight bag, and of course your trusty walker. Loose-fitting clothing for when you're up in the hallways after surgery with physical therapy and when you go home. Make sure you got some good shoes with some non-skid treads so that way you're not slipping or tripping in the hallways as well. If you use a CPAP machine at home, make sure you bring that with you because you will be spending at least one overnight. If you have any dentures, hearing aids, glasses, make sure you bring the cases if you have them so that way we can protect them when you go to surgery. After you check in downstairs, the admitting area will bring you up to the surgery department where you will meet with myself or some other team members. And you can expect to be in the pre-op area for about 2 hours prior to your surgery. And in the pre-op area, we are going to get everything finalized into the computer, make sure we check your last doses of medications, start your IV, give you the proper fluids and medications that you need. You will meet with anesthesia that morning along with your surgeon, so if there's any questions at all, don't hesitate to ask us.
I'm talking to you today about the anesthetic procedures that are going to occur on the day of surgery. The preoperative nurse is going to give you some preoperative medication that the anesthesia department has ordered. Those medications are non-narcotic medications meant to help with your pain post-operatively by decreasing the inflammatory response that occurs during surgery. And then we're going to get you ready to have your anesthetic for the surgery itself. For total knee replacement, we always do spinal anesthesia with heavy sedation. There are several reasons that we prefer that over general anesthesia. The biggest reason is because patients who are having a total joint replacement are likely to develop a blood clot more likely than the average person. A spinal anesthetic decreases that risk, so we feel like that's a benefit to you as the patient. Additionally, having a spinal anesthetic is going to decrease the amount of pain that you experience in the initial post-operative period. That's 6 hours immediately following surgery. And the final reason that we prefer spinal anesthesia over a general anesthetic is because we don't have to put a breathing tube into your airway. You get to take a very nice snap with a little bit of oxygen through a nasal cannula, but the spinal anesthetic is the primary anesthetic agent that we're using while you sleep in the OR while the surgeon is operating. Before we take you back to the OR, though, we're also going to do some ultrasound-guided nerve blocks. Those nerve blocks help with your post-operative pain by localizing the nerves that feed your knee. Those nerves are all sensory in nature, so this doesn't affect your ability to get up and move or to do physical therapy, but it is going to decrease the amount of pain that you experience for the first 24 to 48 hours. The nerve blocks are done under ultrasound guidance to help prevent any damage to underlying structures or to the nerves themselves, and we do them pre-operatively for a couple reasons. The biggest reason is because once the surgeon has inserted the new components for your knee, we don't want to increase the risk of infection by inserting a needle. But additionally, we're decreasing the amount of pain that those nerves are experiencing by shutting off the pain signaling that they're sending back to your brain and your spinal cord. As with anything else we do in medicine, they do come with their own set of risks. So we do these procedures under a sterile technique to help decrease the risk of infection, as well as decreasing the risk of bleeding. If you have more questions about those nerve blocks, feel free to ask the anesthesia provider at any moment and they can explain them to you in further detail. We're also going to give you oral medications and some IV pain medications that are non-narcotic while you're here with us in the hospital. Those medications we want you to continue after surgery because they help decrease the inflammatory process. You're going to get better pain control out of your post-operative care and therefore better results from your total knee. We look forward to having you with us.
The day of the surgery, I'll see you in the preoperative area. We'll mark your knee. We'll get you taken back to the operating room, get everything prepared. We expose your knee joint. We use special tools to size your knee appropriately and perform the bony cuts or resections to fit the implant that you're going to receive. When everything's fit in nicely and we have a nice balanced knee, that's the end of the surgery. We close the knee back up, nice watertight closure, have a nice dressing on, and we get you ready to go back to the recovery area where you'll spend some time with the nursing, make sure everything's stable as far as vitals and all your pain is well controlled. And then you'll be taken to the floor where you'll spend the rest of the hospital stay and start your rehab and recovery.
Here's what to expect while in the hospital after your operation. Physical therapy may try to get you up to the bathroom with a front-wheeled walker the day of surgery if the feeling has fully returned to your legs. The morning after surgery, physical therapy will make sure that you can safely get in and out of bed and walk and complete stairs if you have them in your home setting. We will go over a home exercise program with you before you're discharged.
After your procedure, you'll likely have some prescriptions sent to your pharmacy. Your medical team will review these with you prior to discharge. They could include pain management medications, antibiotics, blood thinners, or anti-inflammatories. You'll also have some more options for comfort, like ice or elevation, that your doctor or therapist will cover with you.
Congratulations on your new knee. It's time to begin your transition home. Most patients will return home the day after surgery. You will need to have someone available to drive you home. Please consider the vehicle that you will return home in. If the seat height is tall, you may have difficulty getting into the vehicle. If it is too low, you may have trouble standing up out of the vehicle once you return home.
Here are the steps you should follow for a safe car transfer. Move the seat back as far as possible. Back up towards the car like you're going to sit in a chair. Balance on your surgical leg while using your non-surgical leg to push up into the car. Use the running board if it is available. Use grab bars or the car's dashboard as needed to aid in pushing up into the car. Scoot right as much as possible to provide extra room to swing your legs in.
Recovery after knee surgery is challenging at first. It's a combination of pain relief by oral pain medication, physical therapy, and just giving it time. That's the key with this. Usually after a week or two, people start to get a lot better, and when I see them back in clinic, things are improving greatly by 4 to 6 weeks. It is a challenge, but things keep getting better.
Activities of daily living may be challenging after your knee replacement, but Floyd Valley Therapies can help make your transition a smooth one. Keep in mind these recommendations and precautions. When you stand or walk, place only as much weight as feels comfortable on your new knee. Keep your knees in line with your toes while turning. Avoid bending at the knees to pick up items off the floor without additional balance and support. When dressing, we have some additional recommendations. Dress the surgical leg first with pants and undergarments. Don underwear and pants while sitting and then stand to pull both up. Use a sock aid and grabber as needed. Slip-on shoes may be beneficial as bending to tie shoelaces may be difficult. Occupational therapy will provide other recommendations for dressing after surgery depending on how you are recovering. Lastly, occupational therapy will discuss your home and bathroom setup during our evaluation following your surgery to determine any additional needs.
Total knee replacement patients will typically start outpatient physical therapy within 2 days of going home. You will want to show up a few minutes early to check in at the information desk before your first appointment. Appointments are typically 45 minutes long. Total knee patients are typically seen 3 times a week. You will need someone available to drive you to outpatient physical therapy appointments for at least the first couple of weeks.
Once you're home, if you have issues or questions about your knee replacement, the staff at Floyd Valley Healthcare is a phone call away. And thank you for choosing Floyd Valley Healthcare for your total joint replacement.